So today I have in my office John, a 5-year-old child, and his mother. Um, John is here with a chief complaint of a right ear pain. So what I'm going to do first, since I have a 5-year-old child here with his mother, I'm going to get a brief history and ask some questions that John may not be able to answer correctly. So we'll ask his mom. So when did John say that he first started having this ear pain?
2 days ago.
Okay, and where is the pain in the ear located?
On the outside of the ear.
Okay, and for how long does he usually have this pain for?
Well, it's intermittent. It lasts maybe half a minute, and then may not have it for a while.
Okay, and how would you describe it? How does John describe it to you?
He says it's itchy, it's irritated, there's a dull pain, and sometimes he feels a fullness in his ear, like a pressure.
Okay, what makes it worse? Does anything make it worse for him?
Yes, when he's eating, chewing, and movement of the jaw, any movement of the jaw, and when you touch it.
What about anything that makes it better? Anything that gives him relief?
Well, if he's staying still, not moving, not eating, and we've given him some Tylenol.
Okay, so you're treating him with Tylenol.
Yes.
And how would you say, like based on his general, appearance and his facial features, what would you say the severity of his pain is when he's touching his ear?
Based on a scale of 10, I'd say it's a 7.
Okay. So next, I'll ask like a brief, get some historical background on John. So I'm gonna ask John's mom if he has any history of any medical history, any pertinent medical history.
Well, he gets occasional colds.
Okay, that's all pretty much is.
Yes.
Occasional colds. Okay. What does he usually do during the summer months? We're in summer now.
Swimming a lot. There's a lot of swimming.
Okay. Is he? Do you send him to daycare, and is he around other sick kids at all?
Yes.
Okay. Do you often get involved in doing the hand washing with him, and is he washing his hands thoroughly with soap and water?
Yes, he's washing his hands properly. I do help him cleaning his ears.
Do you feel like you clean his ears too often?
Perhaps we might be doing that.
Okay. What about when he gets out of the bath? Do you help him dry his ears thoroughly?
No, not thoroughly, no.
Okay. Does he have any pain when he's lying on his back at night, when he's sleeping, when he's lying down?
No.
Okay. What about any feeling of pressure on his face at all?
No.
Okay. What about any swelling on the face or any tenderness?
Right in front of the ear and behind the ear.
Okay. What about any nasal discharge? Has he complained of a stuffy nose? Is he having anything like that?
No.
Okay. And do you know if he has told you about a fall? Did he fall and hit his head? Have you seen him fall and hit his head?
Not that I'm aware of, no.
Okay. Is he complaining of any weakness or feeling tired or not wanting to do his activities during the day that he usually does?
No.
What about any dizziness or loss of balance?
No.
So next I'm going to do like a review of systems with John's mom's help. We'll do these are subjective questions, so as what John would answer for me if he could. So let's start with, does he have any feelings of any chest pain or his heart fluttering? Does he ever state that to you?
No.
Okay. What about any coughing? Has he had a cough? Any complaints of a cough?
No.
Okay. Does he state that he has any pain in his abdomen? Feeling like he can't go to the bathroom, like he's constipated?
No, does not.
Okay. What about any pain in his head, anywhere other than the ear? Pain in the head or neck area?
Nope.
Okay. And has he stated to you that he banged his head or hit his right ear playing with kids in the water or anything like that?
No, he has not said anything.
Okay. What about any facial pain or swelling or tenderness on his face?
He has pain in the front of his ear and behind his ear.
Okay. What about any pressure? Does he complain of any pressure or feeling like a fullness in his face, like below the eyes and above the eyes,
No,
like here and here?
does
Okay.
not.
Okay. What about any swollen? Like, does he complain of any swollen glands or feeling like he has bumps on his neck or, or mouth area?
Well, there is a swelling in the front of the ear and behind the ear. A feeling of swelling, yes.
Okay. Does he complain of any vision changes? Is he complaining of any drainage coming from his eye?
No.
Okay. So with the right ear, and it's only the right ear, correct? It's not the left. It's not left involvement. Just
Absolutely
the right ear.
right, just the right ear.
Okay. Does he have any pain when he states that he's having pain when he's eating and touching the ear? I think we said that before.
Yes.
Okay, and that he's having some itchiness, and you've noted some drainage coming from the ear.
Right.
Okay.
Whitish drainage, right.
What about his nose? Does he have any nasal congestion? Has he been stuffed up nose, runny nose?
No.
What about a sore throat? Have you noticed any redness in his mouth when he opens his mouth?
No.
Any swollen tonsils?
Haven't seen any redness in the back of his throat.
Okay. Okay, so next I'm going to do a physical exam on John. We'll start with the quiet parts of the exam first. As with a young child, it's most often best to do them first. Throughout the course of the visit, the child might become fidgety or irritated. So we'll start by listening to his heart sounds. Okay, I do not detect any murmurs of any kind in John. There's no irregular beat. He has an apical beat noted at the fourth intercostal space in the midclavicular line, which is normal for a person of his age, a 5-year-old child. So next I'll listen to his lung sounds. John, if you can sit forward for me, I'll listen to your lung sounds. Can you take a deep breath for me, John? In and out. Okay, again. Okay. 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 All right. So John's lungs are clear bilaterally. There's no signs of no wheezing or crackles noted. Next, I'll listen to his abdomen. John has active bowel sounds. I'm going to palpate the abdomen. It doesn't elicit any pain in John. John does not have any pain. It is soft. It is tender abdomen. Soft, non-tender abdomen. So next, basically, what we'll do is the next part of the exam will be like an HENT, which is like a head, neck, ears, eyes, nose, throat, and mouth, throat, and mouth. So we'll start with the head. Okay, we're going to palpate John's head, and the purpose of this is because he comes in complaining of right ear pain. So I'm going to look at the crown of the head and then go to the back. Okay, looking through the hairline for any signs of abrasions or cuts or bumps or bruises. He does complain of ear pain, so we want to be able to rule out that he's not had any head trauma or fall and hit his head or hit his right side of the ear. I see no bumps or bruises, no cuts, Everything appears fine. There's no tenderness when I palpate his forehead and his the top of the skull. So next we'll look at the face. I'll look for symmetry of his eyes, ears, and his nose. The ears are in proper alignment. His eyes are in proper alignment for his face. His nasolabial folds are symmetrical. John, can you smile for me? Okay. John has a symmetrical look to his face. When he smiles, it's equal on both sides. Next, I'm going to palpate John's sinuses. In a child of this age, you can normally only palpate the maxillary, which is right here. So I'll use my thumbs and gently press and rotate around. It does not elicit any pain in John. I'll do the frontal sinuses. It also does not elicit any pain in John. Okay, so the next part we'll assess assess John's lymph nodes. So we'll start with the preauricular, postauricular, occipital node, parotid node, submental, the submandibular, the tonsillar node, the deep cervical chain, the posterior cervical chain. And when I look at all the lymph nodes and I palpate, there's nothing on either side. So there's no swelling or tenderness or feelings of bumps or lumps or inflammation when I palpate all of these nodes. Okay? So it doesn't elicit any pain in John. Next, we're going to take a look at his eyes. We're going to inspect the outer portions of the eyes. His eyes are, the globes of the eyes are symmetrical. The folds of the eyes, the eyelids are symmetrical. He doesn't appear to have any drooping of the eyelid or ptosis. Now I can assess the conjunctiva. So I'm going to just pull down on the lids of John and look inside his eye. I do not see any drainage, any redness or swelling. We could also evert his eyelids, maybe with a cotton tip swab, and look at the top portion of the lid. There is also no redness or swelling or drainage or anything coming out of the eye. There's no foreign body. Next, with my pen light, we'll assess the looking for alignment of the pupils. So with my pen light, I'll take a look at John's pupils from about like 30 centimeters away. I see that he has white reflex in one eye, which is in the same spot in his right eye. So they are symmetrical. It's a symmetrical corneal light reflex. Next, we'll look at the red reflex for any cloudiness or opacities in the eye. So from about 25 centimeters away, we'll look at a lateral angle, 15 degrees. We'll look in the eye, and he does have the red reflex as I come closer to his eye, is in both eyes, and it is symmetrical. So basically, the reason why I would check that is also he comes in complaining of right ear pain. We want to make sure that we rule out any type of head trauma. So head trauma could result in trauma to his eyes. So we want to look at everything thoroughly. Next, with my otoscope, we're going to assess John's ears. So we'll start with the affected ear. He comes in complaining of right ear pain. So in a patient that's 5 years old, it is important to remember that when assessing the auricle of the ear, we want to pull down on the pinna and back. Okay, so we're going to pull down and back on John's ear, and I'm going to look inside, looking at the external structures. I see some redness near the tragus. I see redness in the outer portion of the pinna here. I see a little bit of, now it's dried up, kind of whitish drainage. It is not actively flowing. So the next thing I would do would be to look into the internal aspect of the ear. So again, with my otoscope, we'll go actually in the ear, and I'll be assessing the tympanic membrane. The tympanic membrane appears to be translucent. It is not bulging. It is not reddened. There is no fluid line behind the tympanic membrane. That would indicate, like an otitis effusion or otitis media. I do see the white drainage. That's the only thing that I see. There's no foreign body in the ear. The tympanic membrane is not perforated. We'll check John's left ear as well, of course. Again, pulling down and back, assessing the external part of the ear. There's no redness in this left ear. There's no drainage. He does have a little wax in this ear, as opposed to the right ear where he does not have any earwax. Again, looking at the internal structure of the eye, the tympanic membrane is translucent. It's not bulging. It's not reddened. There's no fluid bubble behind the fluid line behind the tympanic membrane. And in each of the ears, then I would next want to just do, using my pneumatic attachment to the otoscope, I'll assess the mobility of the tympanic membrane. So we want to do this because sometimes in an otitis media or an otitis with effusion, the tympanic membrane is not movable. So we'll do with the pneumatic otoscope, and we assess that the tympanic membrane is movable in the right ear. It is also movable in the left ear. So next we'll assess the nose, mouth, and throat. I'll be looking first externally at the nose. I do not see any drainage coming from the nose. There's no nasal flaring. There's no redness of the nose on the outside. I'll look inside the nose with my endoscope, and I'll see that it is patent, and he does not have any drainage. There's no redness. I'll ask John to open his mouth, please, for me, and we'll look inside, looking for any dental decay, any brown spots or marks on the teeth that might indicate cavities. I look at the hard palate. It's in place. It's intact. It's appropriate color. I'm looking at the tonsils. Can you stick your tongue out for me, John? Open your mouth and stick your tongue out. Assessing John's tonsils. They look about to be 1+. They're not reddened. They're not swollen. The uvula is in midline. It is movable. He doesn't have any dryness or cracking to his lips. He doesn't appear to be drooling. Nothing coming out of the mouth. The tongue. Can you open your mouth again and let me see your tongue? Can you lift up your tongue? Okay, the tongue is movable. It is not swollen. It is not reddened. I do not see any marks on or spots on the tongue that would indicate some type of oral thrush. The uvula is in midline. It is not reddened, and it is movable. There are no lesions on the hard palate. I do not detect any lesions in the mouth. The gum line appears to be appropriate color, and I do not see any exudate or drainage coming from his tonsil area. Ready? So next I'm going to go over the findings of the physical exam and the history. We'll recap what we took from John's mom. So my physical exam from a cardiac standpoint, pulmonary and abdominal, yielded no abnormal findings. There's no signs of trauma to John's face, head, or ear, which might indicate that he had a fall, which is the cause of his right ear pain. So there's no indication of that. His facial features are all symmetrical. The sinuses are not tender or sore. He doesn't have any. He only has the preauricular and postauricular pain behind the ear, lymphadenopathy, as we would say. The eyes are symmetrical. He has a positive corneal light reflex and a red reflex as well. There's no swelling or exudate coming from the conjunctiva. There's no redness of the conjunctiva. Only when we assess his right ear did it produce pain. When we pulled down on the ear, when we pushed on the tragus, he had a lot of pain. Was very exquisite pain. There's was some scant white drainage that I noted. like I said, during the exam, the tympanic membrane was intact and it was movable, it was not reddened. The only external portion of the ear that was reddened was near the tragus that I saw in the external portion of the ear. He didn't have any earwax in the right ear. He did have some earwax in his left ear. The nose, mouth, and throat yielded, again, no abnormal findings. So with that, taking into consideration of the history which we did in the beginning, the review of systems and the physical exam, my diagnosis at this time would be an ear infection, otitis externa. My differentials that I've ruled out are acute otitis media and acute otitis media with effusion. The reason how I ruled these out was because there was no reddened tympanic membrane. John did not present with a fever. He does not have any ear pain when he's lying down in a supine position or doing sleep. He has no dizziness, there's no ringing of the ear, he has no loss of balance, there's no vision changes. The tympanic membrane is mobile, it's translucent, and there's no fluid bubble seen behind the tympanic membrane. So I could rule out those findings and rule out acute otitis media and acute otitis media with effusion. So my plan would be to start John on Ciprodex Odic, which is a ciprofloxacin 0.3% and dexamethasone 0.1%. Dexamethasone is a steroid. So the ciprofloxacin is the antibiotic. So this is a combination drop. So the steroid will help with some of the inflammation and the pain. And I would say for him to do 4 drops twice a day for 7 days. And you can continue with the Tylenol for any pain that he's having. Obviously the children's strength Tylenol dosage. And I would just give you some guidance. Pearl's guidance would be that he shouldn't be swimming until the infection clears. Okay, so definitely none of that. And going forward, he should dry his ears thoroughly after swimming and after bathing. I would suggest using a blow dryer on a very low level of heat and to make sure the ears are dry. And during the antibiotic treatment for the 7 days, I would not clean his ears as well. Do not clean the ears. I would make sure that John's fingernails are kept short, so in case he's a young child sticking his fingers in his ears, he's going to cut his ear or make more areas for bacterial growth. And I would practice with him doing the birthday song when he's washing his hands. I would sing happy birthday at least once so that he washes his hands for a length of time that's appropriate with soap and water and cleans them off so that he's not transmitting bacteria to his ears. I would look out for, I would avoid cleaning the ears too often going forward as well. You can clean them, but I would avoid cleaning them too often and going too deep into the ear and I would not use a Q-tip as well either. You might be able to use some type of drop, which is an alcohol vinegar otitic mix, which is 2 parts rubbing alcohol, 1 part white vinegar, and 1 part distilled water. It would be a 3 or 5 drops in his ears after he swims or after he bathes. And I would tell you to look out for signs that the infection is getting worse. If he has a fever, if he has a different color drainage, if it's more frequent drainage, it could indicate that it's a fungal infection. It's something different, and we may need to change the antibiotic course. At this time, I don't think he needs to be referred to anyone. If there's no improvement in 3 days, then I would say follow up to confirm the diagnosis with me. There could be something that we missed. There could be a foreign body, an obstructed canal, or it could be that you're not doing the drops appropriately. So I just want to make sure that we go over the drops. So John should be laying down when you do the drops. So he should have his head down with the right ear facing up, and you would instill the drops in his ear until you fill to the line of the tragus. And I would pump the tragus as well to remove any air, so you make sure that you get all the fluid all the way up, that it's all fluid and there's no air bubble. So once that's instilled, I would instruct John to keep his head lying down like that for about 5 minutes. Okay, open to air so that the drops can get into his ear and they don't does not fall out. If the symptoms get worse, there's no improvement in a week, then I would say for him to go to an otolaryngologist, and we can discuss that down the road. So that's the physical exam and assessment of John, the 5-year-old child. I would also like to note that in the case of a 5-year-old child, we might have the child sitting on the parent's lap while doing the physical exam. Obviously, in this case, we were not able to do that. But that would be the only thing I think that I didn't show or explain in the beginning of the footage. So that's it.